TEDxPortland is back this weekend, celebrating 11 years of ideas worth spreading. And all this week on Sunrise, we're getting to know some of the speakers. This morning, I talked to a doctor from Washington who was on the front lines in the fight against COVID. His work impacted the world. Now he's sharing his predictions about living with the virus in the future. March 2020, the World Health Organization declared COVID a global pandemic. People around the world were dying. Businesses and schools shut down. The public was suddenly urged to stay home for safety. And then, the first case in the U.S. was identified in Washington.
I'm typing to my chief medical officer, Houston, we have a problem.
Dr. Yuan-Po Tu from the Everett Clinic near Seattle recalls the first frantic days of the pandemic.
And it was incredibly scary because we didn't know how deadly it was.
His medical team found itself at the center of the storm. The state of Washington had the country's first patient hospitalized with COVID. And Dr. Po Tu's team treated the first person infected through community spread, meaning they got sick without traveling overseas.
This person hadn't come from China. It was a person who was native to Everett.
Within days, the crisis center in Everett was turned into a full trauma center, with more and more cases coming in the door. The pandemic was here.
At the time you're doing it, you're just focusing on the team. You're focusing on everybody's personal security, their mental health, the safety of patients, the safety of providers.
As the pandemic became a broader reality for the nation, Dr. Po Tu's team accelerated the science that led to more advanced treatments and faster ways of testing for the virus. His team developed the less invasive nasal swab that's now widely used to test for COVID. Within days, news of their work went worldwide, and soon everyone was using it. Now, 3 years later, the crisis has passed, but there are lessons learned. Perhaps the greatest success scientifically was how the world came together to develop a vaccine. But Dr. Po Tu predicts the virus will be with us forever.
The genie is out of the bottle. There's no way we're going to be able to contain it and put it back in the bottle and make it go away.
And as he looks to the future, he says there is encouraging news. The vaccines worked, and Dr. Po Tu says as people have become vaccinated, more of us will have some degree of immunity. However, it's still a threat, especially to groups, including the elderly.
There's still 2,000 people dying a week, and that seems to have disappeared from the radar of most people.
There's also something else he worries about.
What keeps you up at night about COVID?
Long COVID. So long COVID is when an individual gets infected and they don't get better. We don't know why it occurs, we don't know how it occurs, we don't know what makes it better, and we don't know if it will get better. That's what worries me, and that's why I try not to get infected even though I am fully vaccinated and boosted.
Air travel makes us more connected than ever before.
You can take a flight from any place in the world and land in Portland within 24 hours. If you have a virus that can be transmitted asymptomatically, somebody without symptoms, they can get on a plane and fly to Portland and become ill 2 or 3 days later or a week later and start transmitting it within Portland. And so the world has shrunk literally to a 24-hour time frame.
But Dr. Po Tu says even in the face of that fact, he's hopeful.
I'm basically an optimistic person, and so we will survive this. We have survived every pandemic, and we will survive this one, and we will survive the next one. Hopefully what we will learn is how to do it better next time.